welcome to the Road Home's 21st annual One by One event. I am so excited so many of you are joining us this morning to show your support for the Road Home. Some of you have been coming to this event for many years. Others of you are hearing about the Road Home for the first time. Whether it is your first One by One event or your 21st, we are here today to inspire you to be a part of the Road Home family. One by one, we hope to connect you to the mission and work of the Road Home and to foster your commitment to helping people overcome homelessness and move back home. My name is Alicia Gleed, and I am so honored to be your MC this morning. I started with the Road Home 14 years ago as a volunteer and just fell in love with the mission of the Road Home, the work that they do, the people that we serve, and how hard they work to overcome homelessness, and especially our dedicated team who works so tirelessly each and every day to help people overcome homelessness. I am honored to be with you this morning. I would like to let you know that the most powerful part of the event happens in the last 10 minutes. So if you need to leave early, please be sure to make your donation via our website. There is a link in the chat box for your convenience. I want to thank our sponsors, the Clark and Christine Ivory Foundation and OC Tanner. Because of their generosity, all monetary gifts up to $30,000 this morning will be matched dollar for dollar and will go directly to the programs and services that help people step out of homelessness. To get us started this morning for our event, we would like to show you a brief video about the Road Home and the work that we are able to do because of your support.
It served as a cornerstone of Salt Lake County's community. Originally established as the Travelers Aid Society to help stranded travelers, our agency has changed and grown over the years to meet the ever-increasing needs of people who have become homeless. In 2001, we officially changed our name to the Road Home to better reflect our mission of helping people step out of homelessness and back into our community. Not long after, we began operating under the Housing First approach, a national best practice showing that moving people into homes as quickly as possible, then providing supportive services to optimize stability, is the best way to address homelessness. We implement Housing First principles in all our programs.
So the only cure for homelessness is housing. We can do anything in the world we want to do, but the only way to end homelessness is to provide housing.
All the problems that you have in your regular daily life, or the responsibilities you have, or the routines you have, generally start out of your home. And if you don't have a home, then finding a job can be hard, paying bills can be difficult because you don't have an address for those bills to be sent to. Literally everything in your life is compounded majorly by not having a home.
What we are providing with housing is not easy, but it is simple. It's providing shelter. It's providing people a place so they can start addressing whatever else they may need to address in their life and supporting them through that with case management after they've moved into housing.
Long-lasting impact that you see that our services have in their lives. The joy on someone's face when you get to take them to their apartment for the first time. After they sign the lease, they get that key and open the door, and biggest smiles on their face.
I got into the apartment. They got me through real fast. I mean, just shockingly got me through. It blew my mind. Oh my gosh, it's amazing having a warm place to come home to. It just feels really, really good. Like to have your own and to be able to get up and clean it in the morning and make your bed and know that it's yours. You know, it's your apartment for the rest of the month. You don't have to worry about not having anywhere to go. It's really your apartment. And you know, I tell God thank you every single day. But you know, I want to tell the Road Home thank you, you know, for the work that they put in making sure that people like me are getting off those streets. This is huge for me, and that's why I appreciate it so much.
The Road Home envisions people moving seamlessly from the cold streets into warm housing. If you're experiencing homelessness, please call 801-990-9999 or visit theroadhome.org for more information.
A Special thank you to Modelic for putting together such a wonderful video about the road home. This past year and a half has been full of many challenges for everyone. We have been so humbled by the outpouring of support from our community during these difficult times through meals provided at resource centers, donations of needed items and funds. All have helped us to be able to continue helping people move home. This panel of our amazing teammates will share some of the important moments during this time. One important note about our panel and our event: the Road Home continues to maintain precautionary measures throughout our programs. Even as our communities begin to open back up, masks, social distancing, and disinfecting continue to be a part of our daily program tasks. These are important measures that we will continue to keep not only our guests, but our staff as healthy as possible. Today's panel and event is being held in multiple rooms to allow our panelists and speakers to socially distance and maintain safety standards. During this panel, if you have questions, please write them in the Q&A box at the bottom of your screen. During the question and answer portion of the event, we will strive to answer as many of your questions as we can. Now, for the most important piece, it is my pleasure to introduce to you our panel for today. Our panelists and moderator include Annie Brown, Housing Focused Case Manager at the Men's Resource Center; Carrie Amon, Gail Miller Resource Center Supportive Services Supervisor; Clara D. Wilson, Midvale Family Resource Center Director; Alicia York, Day Shift Advocate Supervisor at the Midvale Family Resource Center; Carissa Guthrie, Midvale Family Resource Center Supportive Services Supervisor; Kenneth Jordan, Housing Advocate Supervisor at the Men's Resource Center; Matthew Melville, Gail Miller Resource Center Director; Mike Young, Men's Resource Director, and we are so honored to have Sarah Strang, the Road Home's Deputy Director of Crisis Services, as our moderator. If you would like to learn more about our panelists, please click on the link in the chat box. Thank you again, and please enjoy our panel.
Thank you, Alicia, for that wonderful introduction. I have to say that as we have delved into the world of Zoom and COVID, it's provided a variety of insights, including for me today, feeling like this is how it would feel to be an air traffic controller if I got to wear these headphones all the time. So it's been really just a wonderful experience, and thank you for joining us today. So we're going to take a little bit of a step back in time, and we're going to set the stage. It's early March 2020. The world is about to be rocked by Rudy Gobert testing positive and the Utah Jazz becoming an instant national household name by shutting down the NBA. And little do we know what is in store for us. A week later, the largest earthquake that many of us experienced locally, for some of us, myself included, the only earthquake I have experienced, and I would be willing to have that be the only time I do, hits us. So, Kenneth, you're coming on shift the morning of the earthquake at the MRC, unaware of what's about to hit. You're in shift change, the walls begin to shake, confusion sets in. What happens next?
I recall all of my staff telling me to get under the desk because I was just kind of sitting at the table, just looking around, trying to figure out what's going on, and everyone's telling me get under the table. As soon as the shaking had kind of stopped, we all kind of went out and started telling people we need to leave, we need to go. The elevators had shut down, so we had to get our emergency chairs, and to get some people who are in wheelchairs or just aren't able to take the stairs down, we have to take them on their chairs. But we only have so many, so we also have guests and clients with us, helping us take some people down on wheelchairs. Sometimes we would grab one end of the wheelchair, they would grab the other, and we would just make our way down. It was a lot of back and forth with other clients as well. Some of them didn't want to leave. Some of them just wanted to go back to bed.
You know, it's interesting because in all of those times that we practice what to happen for an earthquake, when it actually hits us, we're unsure what to do. Confusion sets in, and we had several aftershocks, some for a couple of weeks after that. And I can remember being in the case management area at the MRC and the entire building beginning to shake. And I have to say that as we were going through building the MRC, There were oftentimes conversations about the earthquake readiness of the building and what that had been like. And I have never been more grateful for that than the morning of the earthquake and then actively being in there as well. So my hat is off to all of the contractors who made sure that our buildings were as earthquake safe as possible during that time as we're looking through different things. So little did we know that that earthquake was going to be the least of our worries with what we were heading into. So, following CDC guidelines, the end of March 2020, screening teams are set up. Our world is in a state of disarray as we're talking about COVID-19 and what is happening. Italy is in a state of emergency and disrepair, and videos are coming out of people in Italy in their apartments and talking about what this pandemic has meant to them and across Europe and those different components. We begin to go into emergency mode within the road home, looking at what are our essential services that we need to be setting up? How are we ensuring that we are regularly monitoring and have a pulse on what's taking place in our facilities? And so we come together and we set up screening teams. Anyone who is working in a position that is non essential to a 24-hour facility and function, they're signing up for slots. If you're coming into a facility, your temperature is getting taken. We had members from accounting all the way through Palmer Court case managers covering the screening shifts. At this point, masks, gloves, hand sanitizers, thermometers, and cleaning products, it's a rat race to find. We're looking at everything we can to make sure that we have items on hand to increase sanitization and also to be able to take temperatures on a regular basis. It's amazing how quickly a regular household thermometer runs out of use when you're using it to scan the foreheads of 300 plus men coming in and out of a facility every single day. I have to also say my hat is off to Canyon School District and Connie, such an amazing partner. For our families out in Midvale, specifically with the kiddos, we wanted to make sure we had the infrared head thermometers versus the ones that go under your tongue or those different components. And we were able to reach out to the school districts and they were able to get us some because you could not find them anywhere. I know at that point in time, we'd done a call out to action through our board and through social media, and we were able to receive thermometers through that. And it was so important that we were able to get those because they allowed us to know what was happening. And when things did end up going in a different direction, we knew. So, Mike and Clara, you guys are at the Men's Resource Center. And Mike, specifically, you've been offered a job as the director of the Men's Resource Center. You're moving in from California, and your first day is going to be April 13th. A few days before that, right around April 10th, we received notification from the health department about our first positive COVID-19 case at the MRC. A whirlwind starts of hour-long meetings. It doesn't matter the day or the time. They're happening on the weekends. They're happening at 10, 11, 12 o'clock at night. And it's a combination of health department, local government representatives, TRH staff, including myself and Michelle Flynn. And we began this deep dive into Zoom and what that meant for COVID. And I can honestly tell you that as part of these meetings, I now have a snapshot of what Mayor Wilson's house looks like at 10:30 p.m., courtesy of this. It's a really interesting time. So I'm going to go out on a limb and say, Mike, it's a first day unlike anything you've ever experienced when you and your new colleague, Clara, meet for the first time and hit the ground running.
Yeah, it sure was, Sarah. I moved back from California, my wife and I, on I think the 5th or 6th of April. We knew that we were potentially seeing some positive COVID cases at the Men's Resource Center a few days after that. I know Michelle and I went into the facility to meet with the health department. I think on the Saturday before our first mass testing event on the 13th. And it was striking to me because it was the first time I had left my house in quite a few weeks to actually go outside and interact with other people. I had been quarantining at home since we moved back. I had just a little cloth mask on my face, and I'll never forget walking into the Men's Resource Center, meeting our partners from the health department who were wearing full-on gowns and gloves and face shields, not just N95s, but full respirators. And I remember thinking, man, I'm a little outmatched here. I need to up my equipment game. And so Michelle and I met, started building a plan for what that first testing event would look like. Yeah, the whole time I just kept thinking, man, I could be on a beach in California right now. What am I doing back here? But the 13th rolled around, and I didn't know really anyone on the team at the Men's Resource Center. It was only the second time I had been there. And I found myself at 7 a.m. trying to gather as many folks as I could, trying to get them down to the parking lot to get tested. And I remember at one point I called someone aside who was running past me at the same time. And I said, hey, I'm looking for Clara. I think I'm sharing an office with her. And she was like, oh, that's me. Let me show you where it is. So Clara, what do you remember about those days?
Wow, those days were really powerful in my experiences at the Men's Resource Center. I was still relatively new to the agency. I had only been in that role for 6 months, but stepping into that role, I had been a big part of getting the move into the Men's Resource Center. So a lot of the shelter systems and things like that. And so by that point, I felt like I knew the shelter very well, and to see things in such disarray was chaotic and kind of in a dream state almost. Everyone was acting more on instinct at this point because we didn't know what to do necessarily, and those days were composed of staff telling each other that they deserved the better mask over somebody else because of how much guest interaction they were getting, saying, no, you get the nice mask, no, you get the nice mask, and based on no experience or knowledge of what PPE was appropriate, and all just really rallying and checking in on each other and seeing if we were okay. Those days also consisted of just long days of tough conversations with guests. Some of our guests were relapsing and really just struggling with the news. Some of our guests were just bolting. They just didn't want to be around anymore. Some of our guests were in disbelief, just like such a wide array of emotions and reactions from our guests and from our staff as well. Things that really stick out to me during that time is, again, like Sarah said, having really late night meetings and just a big leadership team sitting in my office, all collaborating together on something none of us really knew anything about. And it was kind of a pretty humbling experience for us all to look around at each other for answers when we didn't have them. And I think in one night we had developed 7 different spreadsheets that we never ended up using, and we had learned a lot about managing a pandemic kind of on our own. Of course, we had support, but to be fair to the community as well, nobody really knew the best way to respond in those days.
I remember multiple layers of just uncertainty after uncertainty.
Mm-hmm.
And so we didn't know what testing was going to look like. We didn't know how many guests would actually go through with getting testing for this mysterious virus that we had only just heard about several weeks prior. And so once we figured out what testing looked like and got that first event set up, I remember sitting in the office until probably midnight, 1 a.m. that first week, every single night, not knowing what would happen once we got results in, and then what would happen when we identify those guests and actually connect with them, and what would happen when they came back from the quarantine facility. And just every single next step, we had no precedent, we had no information to go off of. We had great community partners with the county, with 4th Street Clinic, with the CDC guidelines that they were passing out, but things were changing hour by hour and minute by minute.
So we're getting all of this information that's coming in about these positive cases. Walk us through what that looks like, and especially for our staff who were there on the front line. Part of what was taking place is that we were receiving so many notifications of positive tests that we were getting that information before the health department could even contact guests. And so ultimately, the burden fell to our TRH staff to notify guests that they're positive for this terrifying virus that has resulted in news headlines with horrifying death tolls. You guys are out there, your teams are actively out there, they're putting themselves on the line each shift. And as these names are coming in from the health department, we're calling into our case management teams, we're calling into our advocate teams, we're relaying who's positive. And Kenneth, you guys are out there finding them and saying, hey, this is the current situation. What was that like when you received, from the time you received the name of the positive guest until we were able to get them to quarantine? Walk us through those steps.
Uh, so it kind of for me, how it felt was a lot of anxiety, or I was almost an anxious feeling, especially going to go and find them and tell them, uh, and then having to like either find them in the dorms and then saying, hey, would you mind stepping out for a moment so we can talk privately? Because I don't want to tell your business to anyone else, but also don't want to freak anyone else out in the area. And so it would kind of be going around and asking people to kind of have these conversations. Um, and some would take it well, and other people, they, like you said, they heard all the news and everything, and so they weren't the most thrilled. And so a lot of time it would be also having to kind of calm them down and tell them like, hey, I'm not entirely sure if everything will be okay or not, but we'll do everything that we can to make sure that you get taken care of as best as we can. Um, and then it would be bringing them down to a waiting area that we would have, and we would call the COVID triage line, and then we would just wait until they would be able to come pick them up. And during that time, it could be a long wait. It could be a very long wait. So we would have to get them lunches, water, anything that we can get them without having to kind of bring them anywhere else closer to non-positive clients. And so it could be like, it could range from 30 minutes to an entire shift of 8 hours. And we would just have to wait.
Yeah, I mean, I remember that first week, we were literally going in the middle of the night and waking people up, and saying, hey, so sorry to wake you up. Can you step outside for a minute? And it was very surreal. None of us had really ever received training for anything like that. I mean, we were all just kind of shooting from the hip and trying to figure things out day by day. And I remember the impact specifically on those guests of ours that were dealing with barriers like severe and persistent mental illness. Trying to wake someone up in the middle of the night that is dealing with severe mental illness, being woken up by a stranger while they're sleeping, and having us say, hey, you've tested positive for this mysterious virus that you've never even heard of. We need you to get on this shuttle that's driven by a couple of folks in hazmat suits, and you're going to be taken to an undisclosed location on the other side of town. Navigating those conversations was so incredibly difficult, and just trying to keep a sense of calm and of comfort, I guess, in the facility was difficult. It was trying. It was really hard.
Part of that too was an entirely hands-on, all hands on deck experience. Not only did we have a number of positives with our clients, like it seemed like every couple hours we were getting a notification that there was a staff member who was also sick, unfortunately. And so not only were we trying to navigate how to get such large amounts of people to a safe place, but also how to staff the facility. And we were really just pulling from anywhere we could to get support. And I have a lot of respect for the frontline staff during those days, because they worked really hard. A lot of people working double shifts, working with very limited team members around them to help support during that as well.
Yeah, I mean, I can't give enough accolades to our frontline staff throughout those days, and everyone who filled in on the screening teams as well. Again, just the level of uncertainty and how brave, how courageous and resilient everyone was to continue showing up day after day. And Claire, to build on what you just said, I mean, there was not only the uncertainty of positive guests, but not knowing who wouldn't be able to make it in for their shift the next day because they had tested positive as well. And so I know in the weeks leading up to the pandemic, even before I came back, far before I came back, there were contingency plans put into place about what would happen if an entire shift was unfortunately positive for the coronavirus and couldn't make it in.
So much work happened within our teams around these different components, and the flexibility and resiliency that staff showed, specifically our staff on the front lines, was just inspiring to see and to watch happen. And Mike, you mentioned our guests who were experiencing serious and persistent mental illness, and There was one guest in particular who was absolutely not going to get tested. And at this point in time, as the health department was trying to better understand this, the Men's Resource Center actually went under universal testing. And he was adamant that he was not going to do that without some very strong documentation of what was being asked for him. And I can remember him writing letters up and our case managers typing them up and Michelle Flynn signing them as our executive director to assure this guest that the authenticity around what was happening and those different components. And everyone really did band together within that time to be able to support those who really are most vulnerable in our facilities each and every day. So I want to take a jump over to Miller. At this point in time, Carrie and Matt, Miller hasn't had a positive case yet. Precautions and concerns are everyone's on high alert. We're all looking at what does this mean? Screening teams are happening, higher levels of disinfecting are happening. But fantastically, it hasn't happened that you've had an outbreak yet. Feels like we're skating by. Things are okay. Then a news alert comes through regarding high winds. I do have to say, as a side note, wind is this awe-inspiring thing to me. It's mystifying that something that you cannot see is so powerful and can cause such destruction in our communities as we're looking at these different components. The windstorm hits. Traffic lights are down, trees are overturned, power is limited in some areas. Miller staff are holding down the fort, and some of our staff, our leadership, they can't get out of their garages. They can't get out of their driveways, whether it's because of lack of power, trees are down, they're blocking the area. And then in the facility, there's no power. Thankfully, the generator kicks on, but there are some ramifications. The elevator is down for a week. Otis, the elevator repair folks, they're backlogged. Obviously, there's a really high demand for them. And at Miller, it's a all gender facility, and it's divided with guests who identify as female being on the top floor and guests who identify as male being on the bottom floor. And that elevator is key for operations, specifically for the women. So what's happening in the facility and how are the guests responding to the lack of power?
For us, with the women being upstairs, it was a challenge. We did have a female that was a double amputee, and her primary caregiver, her husband, was downstairs. So we came up with a solution to have her be downstairs in the barber shop. She felt safer, more secure, especially having him close by. We were without power and without the elevator for quite some time. The building was kind of eerie. It was quiet. There was some flashing lights. We had to be mindful of guests that have seizures, and it was a week of it.
Yeah, it's a really long time as we're looking through those different lenses as we think through. We were so prepared for the pandemic and for COVID, well, as prepared as we could be at that time. Honestly, working with the health department, who were so flexible and nimble as well. But oftentimes the guidance we received from them was changing minute by minute, hour by hour. Sometimes by the time we would get a new plan in place and rolled out, the guidance would change and we'd start rolling out a new plan. And so then to throw in this windstorm on top of that, as we're looking at how to support our guests, it's an additional layer of stress and things to navigate, and staff rose to the occasion as we consistently saw throughout this. And one of the areas that was really impacted by the pandemic in a variety of ways was meal service. It started evolving significantly with COVID as we started to look at how does this look? Our meal services at all of the HRCs rely heavily on volunteers coming in and providing volunteer experiences. We need that assistance. The program was built around the community stepping forward and helping. Now, COVID has stepped in. Volunteers aren't coming into our facilities any longer. We're worried about infection. We're worried about passing infections. We've started social distancing. Our dining rooms, we went from being able to serve everyone at mealtime and having everyone in the dining room to removing tables and removing chairs. Restaurants are shifting from serving the public to serving our shelters. Matt, what does this look like on the front lines, and how is this transition happening?
Yeah, just 2020 was just so full of surprises and so incredibly stressful. for all of us. As many of you probably know, I started 2020 with a beautiful full head of hair, and look where I am now. It's been really hard. But on a serious note, the meal service was something that was very impactful on our programs, because we rely so heavily on our volunteer base to help get those meals out, preparing meals, cleaning up after those meals. And all of a sudden, not having this great army to call upon meant all of our staff members had to really step up to make sure that people got fed. I mean, one of the best ways to keep people happy inside shelters or any place with congregate living or people like that is to have really good food. And the model changed to basically no more hot meals in the evening. It was a lot of sandwiches, a lot of peanut butter and jelly, and just basic sandwiches. And if you've ever tried to eat sandwiches every single day for multiple days at a time, it gets very, very tiring. And I remember one guest in particular. He was fairly new to the shelter, only been there a couple weeks, and he came up to me that evening before dinner meal. He said, are we having sandwiches again? I'm sick and tired of it. And I told him, actually, we're going to have Chick-fil-A sandwiches tonight. And he looked at me, and he was with a little bit of disgust. He's like, don't joke with me. Nobody cares about us that much. And I said, well, you stick around for dinner. And then I came down during the meal service and found him, and he was just so happy that we had, Chick-fil-A sandwiches as a meal that night instead of our normal sandwiches. And the restaurant industry really rallied around the homeless service model to be able to provide nutritious, good meals for our guests. And our board president, Becky, Pickle, was integral in identifying restaurants that could participate in this program and get our guests some great food to keep them going and keep the spirits up. It really helped each day when they were able to see something besides those sandwiches. So it was something that really went a long way and helped get us through that. Something as small as just a nice, a good meal for our guests.
Absolutely. Being able to come in and provide food and a hot meal, sustenance is such a powerful item of comfort for all of us as human beings, and really watching the community rally together to be able to support all of the HRCs and providing those hot meals, where we also had the sack lunches, which were really fantastic, but being able to come in and say, and on top of that, here's something else that we're going to be able to provide you with today. And they were all pre-packaged individual servings that we were able to give out. It really was just wonderful to see come together. And each of the facilities, as they're going through these components, are facing different challenges. At our single shelter, we're looking at the different, how are we modifying beds, and what is that looking like for being able to offer services to our guests? And then out in Midvale, we have the Midvale Family Resource Center. So in May, what started to roll out was universal testing. We were concerned. We'd seen this huge outbreak at the Men's Resource Center. We weren't seeing necessarily those same results in the other single shelters, but there's a lot of concern about kids and kids being carriers and not showing any symptoms as they were looking at that. So universal testing, it starts to roll out. Midvale presents unique concerns. We've got kids there ranging from a couple of day old newborn babies all the way up to kids who are 18 years old. And what we started to look at is, what does universal testing need to look like there, so that we also have a pulse on what things are looking like among our families. The health department worked in conjunction with the Medical Reserve Corps. For those of you who don't know, the Men's Resource Center, we call the MRC, is our acronym for it. Came to find out that the health department calls the Medical Reserve Corps the MRC. So that was an exciting component to navigate as we went through multiple conversations, where we both realized we'd been using the acronym MRC for very, very different teams. But within that, at Midvale, the health department, 4th Street Clinic, Primary Children's, and the University of Utah band together to support our families. We know we need a different testing approach for our kids who are there and for our families. It's something that has to happen. We're looking at social distancing. The Midvale Family Shelter is using every inch of space already in day-to-day operations. So we look at creating a line that starts inside the facility, but then comes around and testing is actually being held outside. As is very indicative of our spring weather. Of course, this testing day falls on a day that's cold, it's windy, it's a Thursday, and it's a dreary Thursday. Uh, Carissa and Alicia, paint us a picture of what's happening in the Midvale Family Shelter as we're getting ready for testing and then testing takes place.
No, just thinking about back to it, I think about just how we as staff are also triaging with each other and making sure that we're okay and asking each other what do we need, and then thinking about what our guests need. And we're working with small children and trying to explain to them that, yeah, there's this thing, it's going to go up your nose. I'm sorry, it's not going to be fun, but we need to do this to make sure everyone's okay. And still wondering, is everyone okay? We really don't know. We haven't seen really any exposure in the shelter yet. So we're trying to figure out what we need to do to make sure that everyone's staying safe, and explaining to kids and their parents, like, yeah, I'm sorry, you may have to hold down your baby while this is being done. And I want to help you and support you through that. So tell me what I can do to help you. And really coaching each other as well, because things that live in my brain are unfortunately little baby cries and little kid cries while they're getting this test done. That's not even fun for me as an adult. So I can imagine how hard that is for a little one too.
Yeah, there is definitely lots of fear and anxiety on everybody's part. My heart broke for the parents that would have to hold their kiddos down, hold their hands down while they were tested. We were scrambling to find stuffed animals in the warehouse, or some sort of prize that would distract the kiddos while they're being tested. So yeah, lots of uncertainty, lots of bravery though. So it was really awe-inspiring to see how all of our teams came together to support each other. Everybody worked well together. It was beautiful.
So one of the components as we're going through this is the challenge of PPE. We're coming in, the health department, they're wearing these ventilators, they're wearing all of these different components where we have masks. Through the generosity of the community, we have these cloth masks that we now are able to hand out and to use, because you can't purchase any of the usual disposable masks that we would. And they are rightfully going to hospitals and those frontline medical care workers that are going there. In these testing events, especially with the families and the young children, we're interacting with them virtually the same as we always did. We're still coming next to them and talking with them. We're comforting them. We're helping the parents with their anxiety that they're feeling as they're moving through this assembly line of testing that's taking place. But it also is scary for us and scary for our staff. And what was that experience like for you during that testing event and the weeks that follow out at Midvale?
Yeah, I have to think back of when we're still getting updates about what COVID looked like. One of the things that came out was high risk groups, and thinking about them and thinking about our individual families. My husband was considered in a high risk group, and thinking about the exposure that I was having at work and bringing it home to him was very scary. And we were having to come up with plans to make sure that we were providing the most protection for everyone. So that meant changing clothes at home in the shelter and putting them in a bag and washing your hands like crazy. There was times where when we could find Lysol or things like Lysol, taking them and spraying them on our clothes and spraying them in our cars. So that way we're providing safety for our families. We also were triaging with each other. Okay, you just went into that room and there could be potential exposure in there. Why don't I go in and I'll take a minute in there so you can kind of get a break and you're not being exposed for a really long time. There was a lot of support, and I think just a lot of like, okay, how do we navigate this, and how do we make sure that we're taking care of our guests, but we're also taking care of each other?
Yeah, it was tricky. We were running on limited staff. Anytime anybody had any sort of COVID symptom, they had to stay home until they were tested. So definitely running on limited staff, doing a lot of risk assessment. if there was a guest that had a COVID symptom, we would have to transport them to a testing site. So lots of, well, you know, who can handle this task and not inflict risk on family members they were going home to, those types of things. So it was tricky.
You know, one of the components that was really unique to Midvale with the families and looking at how to support them and getting either the parents or the children tested was that component of transportation, and how sometimes as we're transporting them into a testing site, it could be a quick event and not take very much time, but sometimes waiting in those testing lines was hours and hours and hours as we were going through. Plexiglass is a scramble at this point. We're trying to get as much of it as we can. I'm telling you, whoever owned a plexiglass company, who could have ever foreseen this coming? Dare I say, it's almost like the current wood issue we're seeing right now. But we're looking at putting up plexiglass barriers anywhere that we can. We're disinfecting vehicles. We're looking at all of these components because we're still learning. Is this airborne? Is it stuck to the materials that are happening and those different components? And we have to shift all of the services that we're providing. Everything is changing. Our community is shut down, and it has been at this point in time for several weeks. So, Carissa and Annie, as we're looking at these different components, the key item that the Road Home is always focused on is housing. We know that the way to end someone's homelessness is to find a housing solution that fits their needs. Uh, we never lose sight of that as we're continuing to go through this pandemic. How are services modified to continue to have that housing focused in a world that looks nothing like it did 2 months before?
Yeah, so, in order to get housing, you often need to have documents. You need a social security card, a birth certificate. All of these offices were shutting down. The Social Security Administration is still closed. Clients can't go in and physically get a social security card like they used to be able to. DWS was no longer coming in to help people get food stamps and Medicaid. So we were really having to shift the way that we did services. So we were finding alternative routes to order social security cards. We were doing it by mail. We became DWS. We were filling out food stamps and Medicaid applications with all of our clients. And we were learning how to provide services that we weren't providing in the past in order to still help our clients get into housing.
Yeah, and I remember so many of our community partners were willing to continue doing video conferencing as a support for our guests. And so even if someone wasn't able to come on site anymore, they were still very, very supportive in setting up Zoom meetings with clients, continuing those appointments, telehealth appointments, et cetera. But what that opened our eyes to was the severe gap in computer literacy for a lot of our clients who I know I still struggle with Zoom meetings. Almost every single day, I'm talking to someone on Zoom and I forget to unmute myself, right? And so to expect someone who maybe hasn't had a personal computer in quite a while, or doesn't have the latest software on their computer to be able to navigate this fairly complex online virtual meeting system was a challenge. And that put a lot of the heavy lifting of continuing to get guests connected to resources on our frontline teams, on our case managers, on our housing advocates. Annie, like you said, we had DWS there. We had a variety of different community partners that were still willing to engage. But we had a lack of computers. We had a lack of computer literacy for those that could access a computer and actually connect with those resources. And so your teams had to step in and help navigate those different systems for people, which for me was definitely a side effect of the pandemic that I never could have anticipated.
Yeah, and I agree with what Mike and Annie have both said. It was definitely challenging, and we had to think quickly on our feet about what services can we still provide. There was days where we're trying to make sure also there's not too many staff in one room, and we're trying to mitigate the exposure risk that everyone is having. And then I also think about we had children still trying to figure out school during this time and trying to help them feel like they were getting the attention they need. I say often I feel like I was a school counselor at one point, trying to navigate how to get kids still to do their homework and to help them feel like they were being heard and that their needs were being met. A lot of our parents were frustrated on how to navigate a computer and how to get their children into courses. And I think that all of us took on many different roles that we weren't anticipating. And that's also the kind of beauty of case management and what we do here at the Road Home is we're quick to think on our feet and we're willing to kind of step in wherever we need to. And we're not afraid of the unknown.
Yeah, the school situation that we were facing out in Midvale was really presented just unique challenges. Even for your everyday family, having your kiddos now be homeschooled was hard. I will tell you that it very, very quickly became clear to me I was never meant to be a homeschool teacher of any kind. It was very hard. It was difficult. We're trying to navigate multiple components. And I have a home that I get to go home to every single day. And it was difficult. What did that look like for our families who didn't have that? How did the shelter adjust to being able to support homeschooling 60 kids in one building?
Well, I mean, to kind of paint a picture on how Midvale looks, we have an open dorm living area, and we house individuals in one big room. So you can imagine trying to have all of these small, cute kids and teenagers at home trying to do homework, and it's loud. There's little ones running around. There's conversations happening. Everyone's trying to get on these Zoom meetings. It felt like nearly impossible what we tried to make work with what we did. We actually were able to have 2 tents set outside of our facility, and those were spaces that we often ask guests, like, would you feel more comfortable being out there? We can help figure out what would make you guys more comfortable, help you get your child logged on. There was a lot of problem solving with Kenyon School District figuring out what we can do. And I do remember that we had the parade for the end of the year for the students. They came through the parking lot, and it was a bittersweet moment knowing that these students were going to see their teachers or their classmates again for the rest of the school year. And I'm crying because it just breaks your heart to know that these kids really don't know what is going on in the world and what we're doing to protect them, and all they know is they're not seeing their their friends or their teachers anymore.
And Alicia, what did that look like for our frontline advocates as we're going through these monumental changes?
Yeah, the school situation was definitely trying. Our shelter does not have a lot of extra space to use. So we were shutting down offices that used to be, for our advocate staff. We were closing those down for the kiddos to go into to do their online schooling. But then we were told, well, you can only have one family in this room at a time. So it was tricky trying to get, the kids and the parents used to the online system. It was hard. I'm sure the kiddos missed seeing their friends every day at school. So Connie, our school liaison, was amazing. She was constantly bringing laptops and hotspots and, dealing with Wi-Fi. We did it. It was tricky, but we did it. And our staff is amazing.
I'll say that was consistently the theme that continued to come up over this past year was the resiliency, the hard work, and the dedication that our teams have to the guests that we're serving and to the mission of our agency. So we're going to start now with some Q&A as we're moving towards the end portion of our panel. Thank you guys again for joining us. So we have a question from Kyle, and he's wondering, how was quarantine handled for guests with close contact of positive cases? Seems extremely challenging given how broad that exposure could be living in such close quarters. And then he also wants to throw out there, great job for all of the hard work the team did, which we echo as well. Thanks, Kyle. So I'm going to throw this over to our MRC team as they really navigated a lot of those components in really high numbers.
Yeah, during those days and weeks, we became expert contact tracers. We worked directly in collaboration with the health department and our partnering agencies to kind of identify, did we need to test entire dorms based on how many positive results? Did we need to just test those around them? And it changed every day based on the guidance that we were getting. And so we had developed even more spreadsheets and even more maps of the facility. And we knew where every single bunk was very, very well. And we would, with every single guest who had tested positive, assess what the dorms looked like and then create a new list, a new testing list. And so then we would reach out to those guests who we identified as needing to be tested. And then we would have those folks tested as well.
Yeah, I completely forgot about that whole system we set up. We had a whole bed map, literally every single bunk outlined in every single dormitory. And we would go into it and highlight a bed in yellow or red or something like that to indicate that someone had tested positive. And then we would collaborate with the folks over at the county health department. And they would map out, okay, these folks right here in this radius are at risk and we need to go in and get them tested. And so the conversation shifted not just from, okay, you have tested positive, but you may have been exposed, right? And the CDC was great in handing out the guidelines around, if you're within 6 feet for a certain amount of time, with or without a mask, then you are a high risk exposure. And so we were having those conversations with clients every single day. Have you been around this person? How close were you? Were they in their bunk last night? Were you in your bunk last night? And just doing whatever we could to connect those folks to tests. We saw the burnout rate with tests get pretty high pretty quickly, right? Most of us now have had one of those long Q-tips gently placed into our nostril on more than one occasion. And it's not fun. It doesn't get any easier. And so to go into a dorm again and again and again, week after week, and say, hey, so sorry, you need to get tested again, that led to a lot of frustration for a lot of people.
And just jumping in here, also with the families, we have, like I said, small children running around. It was extremely challenging having to explain to small kids that they can't run around and play with everyone, and if they were, they needed to wear a mask and wash their hands. So contact tracing became a unique challenge. We often had to ask ourselves, okay, who is playing with this one and this family quite often? Where do they sleep? Where do we see a lot of this interaction? And having to like explain to families like, we've had a positive case come back and we're so sorry because of the exposure that you and your family have had. We're going to need to get you guys tested as well. But it was an extreme challenge with small ones and just explaining to them that they can't like play games and touch the same objects all the same time.
Absolutely. I remember it was before we were able, I call them the Ghostbusters backpacks that we now have so we can go through and spray and disinfect our facilities. But we'd hired a company to come in and do that. And I can remember seeing them out there and they were spraying down the playground as we were looking at that, to have things just be as germ-free as possible, but definitely some very unique challenges there within that. So we have another question in our Q&A. So while this year has been critically tragic and full of hardships, what has come out as a great result from all of this, especially when it comes to those staff members on the front lines? And I think Miller, why don't you guys lead us out on answering this question?
Yeah, I would say one thing that just really gleams from a positive outcome is just how much grit our front line staff has through all of this, really rising to the occasion and doing what's necessary to look out for our guests. So many people went the extra mile every single day, and it just seemed like we were constantly asking more and more and more of our staff members, and they never failed us. They were always there. We were all down, in the trenches doing the work, pulling graveyard shifts when, multiple staff members were out positive with COVID. It just became really challenging, but we were all in this together. I think it was just a really intense teamwork activity that really brought us together.
Yeah, I'll just add in, I'm over at the Men's Resource Center, and I found a lot of moments that I was able to connect with clients over this time, a lot of clients that were afraid and confused, and we were able on the front lines to be a source of comfort for them and a source of information, even with as little information as we did have. And on the other end of things, we were still moving folks out. I had a gentleman who was really medically vulnerable and he was really afraid of staying in shelter. And so our solution was, let's get you out of here. And so, you know, the two of us worked really hard together to get him out of shelter, and now he's in his own place and pretty happy. So I think that's seeing moments like that makes it all worth it on the front lines to me.
And what about out at Midvale?
I have to agree with Annie. Our services just never cease to stop. So seeing people still move into housing and out of homelessness was a great joy. Um, I remember actually moving a family in July. It's sweltering hot. I'm having to wear a mask and I'm wearing my TRH t-shirt and I'm loading up a van and helping them move in. And this little girl I knew for some time and she goes, "Miss Carissa, look, it's my house. This is my room. This is where little brother's gonna stay." And I'm trying to hold back tears because I remember this so well, but just knowing that we were still able to keep people from facing homelessness and that COVID wasn't going to stop us from serving our mission, and that again we were going to step into the unknown no matter what that looked like.
I also have to add, at the time I was the staff manager at the Men's Resource Center, and even just sitting in this room right now, I'm in on this conference call, I'm with two people who have moved into like new or leadership roles. Annie moved into a case management position. Kenneth moved into a supervisory position, and a big win for me and a big motivator for me is not just them, but a lot of people on our frontline teams had moved into leadership positions or moved into roles that they really wanted to move into, and to be able to see that they were so willing to put in so much hard work on the front line and then also put themselves into more challenging positions afterwards. It just felt like a huge win for our team in that way too.
So much work of everyone coming together and seeing those different components. And I am thrilled to have Annie and Kenneth here with us today and moving into these leadership roles, because they bring such immense experience to our team, and it's wonderful to have them there. So as we're going through and we're looking at, there's one more question here talking about having the kiddos that are in the shelter and our families that are under 5 or that have kids who are under 5. And what can we do? What can our community do to help these folks as these families as they're experiencing homelessness and they're looking to find a home of their own? And we're going through those different components. And Carissa, when we think through what it is that we need, and I know my initial instinct is to say, what can we do to help them? We can have affordable housing. Right? We need a home that the parents can meet the rental obligations on and those different components. But I'll toss it over to your team.
You're exactly right, sir. I mean, it starts with affordable housing, but I think the things that we can do in a community is donate when you can. A lot of our funding goes to all over the service providers that we work with within the MRC, GMRC, and MFRC. And I think also think about like if you were in that situation, what would help you? We're always seeking non-perishable donations, clothing, diapers, wipes, anything that helps the day a little bit easier. Formula. I just put myself, if I was experiencing homelessness, what would I need to make this just a little bit easier of a transition for me and my family?
Great, thank you. All right, and I believe that concludes the time that we have for our Q&A today. Alicia, I'm going to pass it back to you.
Thank you all so much. Thank you to each of our panelists. And Sarah, thank you for moderating this, just for sharing so many impactful stories. And I hope I speak for everyone, but thank you for the incredible work that you do every single day to help people overcome homelessness. We are Words can't express how grateful we are for each of you. Thank you so much. If we were unable to answer your question, please feel free to email marketing@theroadhome.org, and one of our teammates will be in touch. I am now honored to introduce to you the Road Home's Executive Director, Michelle Flynn. Michelle has been with the Road Home for over 25 years and has served as the Executive Director of the Road Home since February of 2020. Michelle has a Master's of Public Administration from the University of Utah and serves on multiple boards, including the Salt Lake Valley Coalition to End Homelessness. Michelle specializes in systems planning, emergency shelter, rapid rehousing, and permanent supportive housing. Please welcome Michelle Flynn.
Good morning. It's my true honor to follow that panel. It's a joy and an honor and a privilege to serve as a staff member of the Road Home. It's also a significant responsibility and one that I take quite seriously. First and foremost, I'm so pleased to share the voices and expertise of my coworkers, to share the experiences of the families, the men and the women who become homeless and work so very hard to get back to stable housing in our community. You've just heard from Alicia, Sarah, Annie, Carrie, Alicia, Clara, Carissa, Kenneth, Matt, and Mike. They are incredible, and we are blessed to have them as part of the Road Home. We have many more equally committed team members, all of whom are working every day to end homelessness. From the accounting, data, compliance, facilities departments to our many program teams, each staff member's work is grounded in our housing mission. After watching our video and listening to this panel, you now know how focused this team is on helping people build their strength, how dedicated they are to providing the support that is requested by our guests and program participants, and how they do this with limitless compassion. Over this past year, our programs have continued uninterrupted, with staff adapting and implementing the changes necessary to provide safe and high quality services. As you've heard, many of our team members were redeployed for COVID-19 related tasks, screening guests for temperature and symptoms, arranging for testing and vaccinations, transporting families to quarantine sites, identifying older and at-risk individuals to rapidly help them out of congregate shelters, putting up signage, protective barriers, and staying close to the ever-evolving CDC guidance, volunteering to suit up and administer rapid COVID tests now, and bringing care packages to people we are supporting in our housing programs. They did this willingly, eagerly, and regardless of the potential health danger to themselves. At the same time, we continue to strive for program excellence and continuous improvement. We dig into data analysis and work towards increased outcomes. During this past year, we stepped in to support our community and partner with Salt Lake County to serve as the operator of the Stay Safe, Stay Home motel program, where we provide non-congregate shelter options for individuals with highly vulnerable health conditions. We agreed to serve as the operator of the Gail Miller Resource Center, adding that incredibly special 200-bed facility for men and women to our resource programs. I'm not going to give you a lot of statistics, but I do want to highlight a few. Last night, our teams at the Road Home provided safe shelter and resources to 865 people, including 143 children. Last night, while I was sleeping at home, our night staff were keeping people safe at the 4 resource center locations and 2 permanent supportive housing properties. This morning, while we are talking with you, other members of the Road Home team are putting out breakfast, meeting with people to sign housing paperwork, and helping someone through a crisis. Next, let's talk about housing. So far this fiscal year, from July 2020 through March 2021, our team supported 452 households to move from homelessness into housing with deposit and rental assistance and support services. That is 1 or 2 houses that have moved into housing every single day. Families with children, men and women who are no longer experiencing homelessness. In fact, we are on track to provide twice as many housing nights as shelter nights. We are grounded in helping people into stable housing. This past year has highlighted for everyone what we have known for a long time, and that is that housing is healthcare. There's a direct tie between keeping people housed in safe settings and preventing a health crisis. A safe home provides for better health, more ability to engage with preventative care, a stable base from which to increase income and connect with behavioral health support, and much more. You can't stay safe at home if you don't have a home. We've gone through significant changes in our agency and our services, along with the changes that have evolved on the system level. Not only are we continuing to provide successful programs guided by research and best practices, but we are also working side by side with our partners and stakeholders to identify and work towards system improvements. We stand in solidarity with our state and county and program partners in our overall goal to make homelessness rare, brief, and non-recurring. As we emerge from this challenging year, we also have a once in a lifetime opportunity to help many, many more people into safe and stable housing. We must re-energize and focus and use our data to identify the most impactful housing solutions and use the new resources available from the American Rescue Plan to invest in widespread and deeply affordable housing. Sometimes the challenges facing us can seem intractable. Initiatives are launched and dollars invested, and yet challenges continue. People from communities of color are disproportionately represented in homelessness. We must work hard to create equity in our agency, our programs, and our housing community. I pledge to do that hard work. Most families and individuals who come to us for shelter and resources could have stayed housed if they had deeply affordable rents and community supports. Like most cities across our nation, we are struggling with an increase in people sleeping outside in unhealthy and dangerous situations. We must listen to what they are saying, really listen to what they need to make the decision that there is a shelter or housing option they would rather go to than stay living outside. We must commit as a community to creating these options and commit to providing options for everyone, regardless of our own ideas about what someone needs or must do to have housing in our community. That is how we ensure that everyone has a place to go. Leaders at the state of Utah, county, and city governments have an opportunity to leverage federal dollars and invest state and local funds and private philanthropy to support a solidly resourced, housing-focused homeless system and keep people safely housed in our communities. Now is the time for us to come together with respect, compassion, and data to inform our strategies and investments. We have creativity, expertise, and resolve. Please join us. With our collective voice, we can keep people safe, create this community with a strong commitment to affordable and stable housing, and change the face of homelessness forever in Salt Lake and the state of Utah. I now have the extraordinary pleasure to introduce Becky Pickle, the president of the Board of Trustees of the Road Home. Becky started her volunteer work with the Road Home, providing support and activities to the children staying in our family shelter. She donates countless hours of time, along with her many areas of expertise to our mission. We are blessed and honored to have her as part of the Road Home family. Please welcome Becky Pickle.
Thank you, Michelle. Good morning, friends. I'm really honored to follow our incredible staff this morning and speak on behalf of our friends experiencing homelessness and talk to you about ways that you can engage with us and help. I chose to begin volunteering with the Road Home after my husband and I were foster parents of many incredible children and also adoptive parents, and learned about the experiences of these kids and families, those that experienced homelessness. And once you learn about these things, it's really difficult not to stay engaged and help. And I chose to start volunteering with the Road Home and see where I could make a difference, and began by leading a play group for kids. And I just really fell in love with these families. I heard their stories, I cried with them, celebrated, mourned with them. And through the years, I've met the most remarkable human beings and really heard the most devastating life stories. But I've seen so much good come out of our community as people like yourselves come together to do what they can to help others in need. So I was deeply saddened and discouraged when I learned of the real complexity and size of homelessness challenges in Utah and at the rate it's growing. Homelessness is a symptom of other challenges, and some of these may include the shortage of deeply affordable housing we have currently in Utah to the tune of tens of thousands of homes. As Michelle mentioned, we really need to invest in these solutions. Other challenges include recidivism, sexual abuse, domestic violence, substance abuse disorder, lack of medical insurance when faced with a serious medical emergency, inability to access mental health services or prescriptions, lack of acknowledgement or education and loving acceptance of Utah's LGBTQ+ population, as many of these wonderful Utahns become homeless as youth, job layoffs, transportation barriers, inability to access affordable childcare, senior citizens without loved ones to care for them. The list, it's extensive. The demand on the road home as an emergency shelter provider and a permanent supportive housing provider continues to increase, as we are all aware, due to issues like these and others that cause homelessness. While I have this opportunity, I really have to say how amazed I am at the tenacity and grit of our staff at the road home. They are truly remarkable, good human beings. Their work has never been easy, ever. This last year, they somehow managed to take on an additional resource center during a pandemic and did an exceptional job navigating this massive challenge in a congregate setting. They worked tirelessly in an often thankless and emotionally draining job that not many of us could handle, let alone execute successfully. The road home serves and cares for thousands and thousands of Utahns every year at the most vulnerable time in their lives, when there was no one else raising their hand to help. I have witnessed them work with our city and state leadership to create new solutions and programming, always striving to be good stewards of what they've been entrusted with, always finding a way with very limited resources. Throughout all of the coronavirus pandemic, they remain focused and unwavering. With all the added pressures of the pandemic, they managed to keep housing as a priority, and they were here for those in need when they need us most, 24 hours a day, 365 days a year. They do anything and anything they can to fund best practices that we know the people we serve need. We've had many of our staff working their full-time roles and then actually returning for additional volunteer shifts to make sure everyone was safe and cared for. They work so very hard. I'm so honored to work by their side and learn from them, and I'm so grateful for the tremendous role they fill in our community. Today, you heard from some of these remarkable human beings, and hopefully you're asking yourself how you can help. I invite you today, please join us and be part of the solution. If we work together, we can fund the vital programs you've learned about and help our friends experiencing homelessness receive the support they need to reintegrate back into our community. If you are able, a financial donation to the road home would be so greatly appreciated today. We've posted a link in the chat box here that you can click on and make a donation. We will also post an address if you'd prefer to rather mail a check and make a donation using that method. Again, the chat box shows the link to click on to make a donation today, which I actually invite you to click on now. If you feel called to be involved in finding solutions with us, there are so many additional ways you can plug in. We need all of you. On our website, www.theroadhome.org, you will find a volunteer page that shows many ways you can volunteer as an individual or as a group. While some volunteer options are still currently limited due to the pandemic, there are some current needs we would love to have your help filling. And we hope we're able to open more of these volunteer options back up soon. So please check this page often. We also have information on our most needed items. And if you'd like more information on hosting a drive for these critical items needed in all of our centers with maybe your business, your place of employment, your church, school, or other group, we would be so grateful for your support. You can find more information about this again on our webpage, www.theroadhome.org. Today, I ask you to click on the donation link in the chat box and give what you're able. We truly need and depend on your help to continue this needed programming. You may consider making this a recurring monthly donation and partner with us for future months as well as a generous donor. Thank you for being our partner today by making a generous donation to the Road Home and supporting our needed programming. Thanks to each of you for joining us this morning and being one of the reasons that someone has a warm, safe place to sleep tonight. Thank you.
Thank you so much to all of our panelists and speakers today for sharing their stories with us. You have all truly inspired us. Thank you again. A special thank you to our sponsors, the Clark and Christine Ivory Foundation and OC Tanner, for sponsoring the event and providing our generous match. If you haven't made your gift, please click on the link in the chat to do so. Most importantly, though, I would like to thank each of you for spending time today to learn more about the road home. As Becky said, if you would like more information on our programs, services, or how else you can be involved, please visit our website at www.theroadhome.org or email info@theroadhome.org. Thank you all again and have a wonderful day.